What are the most effective strategies for preventing diabetes?
Hi, my name is Dr. Caroline Mithi, an internal medicine physician, a diabetologist, and endocrinologist. Diabetes type 2 can be prevented, and some of the important strategies to prevent diabetes will be lifestyle change. So, part of lifestyle interventions include proper nutrition, and these entail foods low in glucose and low in carbohydrates, especially the processed carbohydrates, and also exercise, which is key to prevent diabetes, especially if you're at risk of developing diabetes.
How does maintaining a healthy weight contribute to diabetes prevention?
Maintaining a healthy weight is important for diabetes prevention, and this is because when your weight is high or you have obesity or are overweight, then you develop a layer of fat called adipose tissue around your midsection. This causes insulin resistance that is produced by the pancreas, such that the insulin that is needed to store the glucose cannot work because it is being resisted by the adipose tissue. So the first mainstay management is weight reduction. Make sure that you're in the correct BMI between 18 to 24, and also embark on lifestyle change, embark on proper nutrition to bring your weight down.
What are some of the simple dietary changes people can make to reduce their risk of diabetes?
Some simple dietary changes that you will need to do to reduce your risk of developing diabetes will be: 1, get rid of your processed sugar in your diet. So that's the sugar that you put in tea, sodas, soft drinks. That is key. Reduce your amount of processed carbohydrates. This is your white bread, white chapati, and any other form of processed carbohydrates. And aim for taking a vegetable in every meal, and also some fruit, the recommended fruits, and exercising at the regular intervals, at least 30 minutes of exercise 5 days a week to target 150 minutes a week.
What are some of the risks that predisposes one to get diabetes?
So we have 2 types of risk to developing diabetes. We have the non-modifiable, meaning what we cannot do anything about. And these include a family history. If anyone in your family has diabetes, then you're at risk of developing diabetes. The other thing is age. As you age above 45 years, then you're at risk of developing diabetes. And also Black. Another risk factor will be if you've had history of gestational diabetes in pregnancy, predisposes you to developing diabetes later on in life. Other modifiable risk factors, and these are things that we aim to change, will be sedentary lifestyle, meaning that you're not exercising, diet rich in carbohydrates and glucose. And so these are some of the risk factors. And also being overweight or obese also predisposes you to developing diabetes.
Can you explain the importance of regular checkups and diabetes risk assessments?
Regular checkups are important to be screened for diabetes, and these would entail going into a health facility or clinic, and you will have a point glucose test, which is a random blood glucose check. If indeed it is found that it is high, then you will be asked to do a 3-month average test, what we call a HbA1c, and this confirms whether you have diabetes or not. And if found to have diabetes, then it will be started on lifestyle therapy and also medical therapy if needed.
How can individuals raise awareness about diabetes within their communities and encourage healthier lifestyles?
Diabetes awareness is a jurisdiction of each and every one of you and us as healthcare practitioners, and it starts with awareness and accessibility to proper lifestyle change, proper nutrition, proper exercise. And so each of you can be a champion to help prevent diabetes by eating right and exercising. So this Diabetes Awareness Month, we would like to urge all of you to go out and get screened for diabetes, especially if you're at risk of developing diabetes, as mentioned above. But even more so, let us embrace proper lifestyle changes, and this is proper nutrition, and also eat well and exercise more. Thank you for watching. See you next time.